welcome to another edition of Health Talk with Dr. Arie. You are listening to Dr. Arie. So we are following on from our series on cervical cancer. And I hope for those of you that have been tuning in, you are learning lots. If you've been missing out, please do make time to have a listen to the previous episodes so that you can catch up. Without wasting much time, today we are just focusing on the risk factors, the things that increase your risk of cervical cancer, and some of the practical things that you can do to reduce that risk. So the first risk that is can predispose you or increase your chances of cervical cancer is early sexual activity. Now, if you remember last week, we learned the main cause of cervical cancer is the HPV, which is the human papilloma virus, which is contracted through sexual activity. Okay, so early sexual activity in someone's lifetime increases their chance of cervical cancer. And probably this is because, if you started engaging in sexual activity from a younger age, you have a long time throughout your lifetime to be exposed to this virus. Okay, so that's the first thing. So the important thing is to practice safe sex. That's using condoms. That will reduce your risk of getting these infections and other sexually transmitted infection, even though it doesn't completely cover you, because condoms sometimes can go wrong. Okay, also the other risk factors is having multiple sexual partners, at the same time, or even over a period of time throughout your lifetime. That also increases your risk, and it's for the same reasons, because over time you are going to be exposed. With every activity, you are going to be exposed more likely to this virus than if you are not having multiple sexual partners. So once again, be safe, practice safe sex. And also, often, as an individual, you might know what you are doing, but you might not always be able to vouch or guarantee what your partner is doing, whether they've been with other people. Okay, so that's why it is important to be aware of that. The other risk factor is tobacco smoking, so cigarette smoking. Okay, now your risk is higher if you've been smoking for a long time, for many years, or if you're the number of cigarettes that you smoke. So the more you smoke and how long you smoke for increases your risk. Okay, so if you are a smoker, there's so many support and so many things that you can do to help yourself. Do see your doctor to get some things that will help you. Your doctor will be able to prescribe some things for you. If not, also there's the NHS is providing amazing smoking cessation clinics and services all over the country. Often you can even walk into your local pharmacy and be able to get support if you want to stop smoking. So don't feel that you have to do it on your own. I always tell people that habits, they're so easy it's so easy to come up with habits and basically form habits, but habits are hard to break. So often all of us, when we want to make a change, something that we've been doing over and over, when we want to then stop that cycle, it's always difficult, but there's always help around. So if you need the support to help you give up smoking, please do speak to your doctor, speak to your practice nurses, or speak to your local pharmacy or chemist and get the help that you need. And also get your family involved so they can, motivate you and help you to give up. The other risk factor is if you had previous cancer. Yeah, if you had previous cancer, mainly cancer of the vagina or of the vulva or of the kidney or of the renal tract, which is the kidney tract, basically, from the kidney to the tubes that come from the kidney and to the bladder, that also increases your risk. Okay, and really, if anyone has been exposed to have had any type of cancer, really, then your risk of getting any other type of cancer is often higher. Like, with most long-term conditions, if you've had one, like if you have a high blood pressure, then your risk of getting other things are often much greater. Okay, the other risk factor is family history. So we're talking about immediate family. So we're talking about mom, dad. Obviously, dad does not have a cervix, but like we said, that virus can expose people to other types of cancers anyway. So having a close relative, maybe a daughter or a sister or an auntie, that kind of close relatives, okay, that increases your risk of cervical cancer. And lastly, if you've had children but you started having your children much early on, okay, that also increases your risk. And I guess there's no clear reason for that actually, but having think about it, it's possibly because if you started having children earlier, then likely you were having sexual activity much earlier in your life, okay? So that also then increases your chances of exposure to this virus that causes cervical cancer, okay? So those are the risk factors to be mindful of. So early sexual activity, having multiple sexual partners, smoking, family history of cancers, haven't had a previous cancer of any type, smoking, all those things increase your risk of cervical cancer. To a small extent, the oral contraceptive pill as well has been linked to cervical cancer. So and that is more probably if you've been on it for many years, okay? So, and that risk is small, but if you have any concerns or you're worried, if you're on the pill, which you need for birth control, then speak to your doctor, who will always, review your risk anyway and make a decision whether it's time to come off it or whether you are safe to continue with it, okay? Knowledge is power, and it's always important to be well informed. So if you're not sure about anything, like Dr. Arya always advises you, make sure you speak to someone, speak to the relevant people, speak to a doctor, speak to a nurse, speak to someone who is able or qualified to be able to give you the right answers, or at least direct you in the right direction, okay, to get that information that you need. So I hope this has helped you, and next week we're going to look more at the symptoms, the signs and the symptoms that you should be looking out for on yourself. If you are worried about cervical cancer, what should we be looking out for, the warning signs that we should be looking out for. So I hope that today's topic has been useful for you. Please do make sure you share the videos with other people. You might not find it helpful, but trust me, you might be saving someone else's life. Don't forget to subscribe to the channel. It just means that you will get an alert when a video pops in, so that you'll be able to listen to that, okay? Until then, you have been listening to Dr. Arya, and it's goodbye from me.